healthcare setup. So since we are talking about primary healthcare is key, but ignored. If you see from Declaration of Alma-Ata 1978, primary healthcare forms an integral part of country's health system and is very important for overall social and economic development. If you see healthcare private spending in India, distribution among inpatient and outpatient department, inpatient is 39%, lower volume, 61% is outpatient department, out of which 42% is in the urban area. And if you see technologies in past, have been mostly focusing in the inpatient department, right? But in the outpatient department, let's say when we go and see a doctor, we hardly see any technology, and that's where mTatva's focus is on. We also make a very bold statement that primary healthcare treatment is incomplete. Okay, and I'll just tell you why we feel that. It's nothing related to doctors, right? I mean, it's more on the way that the current treatment is. The first thing is non-compliance. Our survey showed that around 50% of the patient does not follow their medications, and they don't take their medication. This is one of the big issue in primary care. The second thing is lack of information, especially among elderly and women patients. They have a lot of questions around their health, and it is generally seen that when they walk out of doctor's office, they are not fully aware. They don't have all their questions answered. And the reason is not to blame anyone, but it is basically the patient does not remember all the questions, okay, or there is huge queue outside, okay, it could be anything, right? So lack of information. And the third aspect we see is poor access to doctors and health data. So when I say poor access to doctors, it's more towards during the treatment. Let's say if I have to go and see a doctor for any reason, the only way is to actually take an appointment and go, right? My access to my health data, statistics based on my family, community, that is not available. Now, if you see in inpatient department, all this is taken care of. Right? For example, somebody makes sure that I take my medication on time. Somebody makes sure that my all questions are answered. So that's our attempt on seeing with our first flagship product, Health Pie, on how actually we can fill this gap in the primary health care. So Health Pie reminds the patients to take medication on time. So it's like a virtual nurse available. Okay. We make sure that we actually have done extensive research on what patients look for. Right? So we have created medical content. Our medical team has created medical content about illness and medications to answer questions, most of the questions of patients. And we also give access to doctors' records and statistics to primary healthcare patients with very low barrier. Okay. So just to give you an example of a use case. This is a live use case. I just take before and after. Vitamin B12 deficient patient, one of our patients. So before she was diagnosed for vitamin B12 deficiency, and she was into I don't know phase. I eat a lot of fruits and vegetables. Then why did it happen to me? And then she said, so what? In India, tons of people are vitamin deficient. But then she's surprised. Doctor actually have advised me 1 year-long treatment plan. And that somehow taking injections for a year, it's so painful. But she says anyway, doctor said let me go ahead with it. 3 days pass by. She's actually taking 1 week every day injections, then weekly for 1 month, and then monthly for 1 year. Now, after 3 days, all of a sudden she says urine color changed. Patient she's worried what to do. She actually wants to go and see if she's worried. Is medication giving me some allergy or anything? She actually calls for an appointment, didn't get appointment during peak hours, so she actually have to go and take time off and go and see the doctor. And when actually she went and saw the doctor said that it was expected in the sense that when you actually take vitamin B, excess of it is excreted in urine, and that's what changes the color. So, it's a waste of time, right, for both doctor as well as for such a thing which was expected. And then third thing, after 1 month, she realizes that from last 3 weeks she hasn't taken an injection because she forgot. And then now she thinks, okay, anyway I've messed up with my treatment plan already. She gives up that another year of treatment plan, and in 1 week the whole story ends, right? Because she is not aware what could be the complications of what, and she forgot. Now let's take the same case after, actually the same patient on health part. Right? She is fully aware through our information system that only natural source of vitamin B12 is animal products. Right? And this now she realizes, okay, she's a vegetarian and doesn't take milk also seriously. She knows what she has to do, right? And she realizes that actually if it is not treated for long, it can cause irreparable damage to nervous system. Now she becomes serious, and now she understands why I have to actually take 1 year treatment. Okay, so she becomes serious. After 3 days, through our system, through tele-follow-up, she actually posts this question on the platform. Doctor answers, doctor decides whether she need to come or not. And in this case, doctor answered, this is expected. Don't worry, stay at home. So, doctor saved time. Doctor actually answered during the non-peak hours, during lunchtime when there are less patients. And she also saved time. And once she is serious, we make sure that through our health pie, she actually completes the treatment plan through SMS medication reminders throughout the year. So we don't let her, she may still miss 1 or 2 days, but overall we don't let her miss. In this case, it was important because it's very tough to remember weekly and monthly treatment. So we did a survey on this when actually we tried 2 months back on around close to 70 patients, 66 patients exactly. What do they think about this whole thing? So I'm actually putting some of it here. So one was the information content, the medical content about illness and medication. So it came out that everyone loved it, right? So all of them said that it was actually relevant, it was in right quantity and good quality. We also actually try to see, are these really the pain points what we're talking about? For example, do they miss the treatment? And 45% of them said yes, they actually miss medication once or the other. Right? And similarly, more than 40% believed that they actually miss their record. I am confident that this number would be higher, because in India we don't hardly see people carrying their files and all that. So they do miss their records. So there was also an open question where if they want to say anything about this, and one of the best thing which I could hear was from a patient's mother. She said that thank you for sharing my responsibility. This was mainly on the SMS reminders and keeping her informed. There were other people who said it's the first time they are undergoing this kind of surveys, and more hospital should follow, it will boost up morale. So, you should actually, another hospital should do it. One of them even said that you actually helped me avoid to do a mistake through the digital prescription. So actually, people on our platform, first thing they receive is whatever is written on the prescription is actually come on their SMS. Okay, even doctors loved it. They said, for example, Dr. Baljit made my life easy. Now actually I can save my time. When actually patients are asking me a question, I can actually give your booklet to them. They can read it and come back to advanced questions. So similarly, some of doctors really loved, Dr. Sunita Maheshwar, she presented one of 2 days at Telemedicon itself. They loved the material, what our doctors treatment prepared. So I think that's all I had. Any questions?
How much is the cost of this?
The way we are doing it is mandatory thing, because it's part of the treatment plan, right? And it's part of the consultation fees. So there is a marginal increase in the consultation fees to the patient.
So at present you have only focused on the women health, or?
No, this is all across.
So it's a transaction based model.
Not really. I mean, there is nothing which actually happens over the web. What do you mean when you say transactional?
It's like per consultation. So
Yeah, it's pay per user.
So did you try in any kind of rehabilitation of the patients, like maybe spinal cord injury or something like that?
This was mainly in the primary healthcare setup with dengue fever, viral infection, asthma, arthritis, hypertension.
Was it a paid service or unpaid service for the patient?
It's a paid service but not an optional. I mean, it's actually sold to the hospital, and hospital then gives this value-added services to their patients. And so there is a marginal increase, a very small increase in the consultation fees.
What about the seeking for information on your system? Do you have lab codes?
Okay, we are actually following web standards like SSL and all that for security. When it comes to ownership, the data ownership as of now lies with the patient. Okay, patient owns the prescription, and doctor who has written the prescription owns the prescription. Okay, other than that, no one owns. Patient, doctor cannot do anything with it, but patient, if he wants, he can actually share it with family members or with another doctor. It's up to him. That's what, and it's a secure login-based cloud platform. And in India, we don't have laws like HIPAA and all which.
Does the patient have any smart card for
Not as of
no. So it can be used for the usual mobile.
So yeah, so the mode is we have a web-based website, okay, web app. A patient can log in there. There's a mobile app. Okay, there's a huge SMS interaction. Okay, and fourth thing is this information is also given on paper. For example, when I, as a patient, go and see and diagnose for dengue fever, doctor will give me a template. This has one-page summary and 7 to 8 page detailed things like how to prevent, why did it happen to you. Most interesting things are, for example, what to eat, what not to eat, what exercises and yogas can help, right? It's very illustrative. And then things like when should I go and see the doctor, right? Which things can happen, and I can say that these are okay, shouldn't be, how much time does it take to recover. So the questions which patients have, all of them with images and all that,
Thank you.
Thank you.